This DRB Media Communications digital news segment sponsored by HQ Chiropractic, serving the Permian Basin for 15 years, helping you recover from your auto and workplace injuries.
Thank you for following us. DRB Media Communications Digital News. I'm Viridiana Marquez, and Danny Barrera has a story.
In 2000, the United States was thought to have eradicated measles, but there has been reported outbreaks in recent years. Within the last several months, health officials began to notice an outbreak of measles in 21 of the northern states, and most recently, Texas is now included, especially in the Houston area.
The cause of the measles outbreak is essentially people who have not had the measles vaccine then develop measles, and then they're able to spread it to others. And measles is somewhat considered a childhood illness.
Many parents in the United States are resistant to having their children vaccinated. Those children that are not vaccinated are at a very high risk of getting measles and spreading it to others. Measles is very contagious and a very serious illness.
Measles in itself can lead to other complications such as pneumonia. It can lead to bronchitis. It can lead to eye infections. It can even lead to encephalitis, which is an infection around the brain area.
The symptoms of measles can emulate a very bad cold or the flu.
You'll have similar symptoms to maybe even like a cold, so more respiratory type symptoms. As it progresses, then you're likely to see a high fever. Fevers can get up as high as 104 or 105 degrees, which was a pretty high fever. And then it's called Koplik spots. You can see like white spots in the mouth, kind of white, patchy looking spots. If you start to notice those, that's pretty indicative of measles. And then there's a rash that develops. And if you've ever seen the measles rash, you'll never forget it. You'll know what it is. It'll definitely start mostly on the face, but then it spreads that upper torso, your upper chest, your upper back. Those areas where you're likely to see this red, blotchy, pimply looking rash, which is very indicative of the measles.
The CDC, the Center for Disease Control and Prevention, recommends the 2 doses that children need to have a lifelong resistance to the measles.
There's 2 doses, so around 1 year's 12 to 15 months. They get that first dose, and then a second dose between 4 and 7 years of age.
It is very important to be vaccinated against measles, especially those that travel internationally. It keeps those persons around an individual safe from the illness. For DRB Media Communications Digital News, Danny Barrera. This DRB Media Communications digital news segment sponsored by HQ Chiropractic, serving the Permian Basin for 15 years, helping you recover from your auto and workplace injuries.
I'm Dr. Ben Quiroz. HQ Chiropractic has been serving the Permian Basin for 15 years, and we have seen minor and major injuries resulting from auto accidents and work injuries. When dealing with many of these injuries, it is best to start conservative in your care. At HQ Chiropractic, we will evaluate your condition and identify the root cause of your pain. We are equipped to handle your situation with digital x-ray, DTS traction, MLS laser, and much more. Come to HQ Chiropractic for your work and auto injuries.
Remember, you can follow us on Facebook, Instagram, Twitter, and YouTube. Also on DannyVisionEntertainment.com. For DRB Media Communications Digital News, Viridiana Marquez.